Welcome to Health Talk Live Talk Show. Friends, as we all know, health is wealth and precaution is better than cure. तो आइए मिलवाते हैं आपको डाइटिशियन डॉक्टर प्रीति गुप्ता से जो कि हमें प्रॉपर डाइट के बारे में आज कुछ जानकारी देने वाली हैं. वेलकम टू द शो डॉक्टर प्रीति, हाउ आर यू?
I'm fine. Thank you very much, Rashmi, for this opportunity.
थैंक यू सो मच डॉक्टर प्रीति, आपने वक्त निकाला हमारे व्यूअर्स के लिए. और ऑफ कोर्स आज के टाइम में हम सब जानते हैं कि प्रॉपर डाइट बहुत ज़रूरी है और ऑफ कोर्स पूरी जानकारी नहीं होने से बहुत सी प्रॉब्लम्स हो जाती हैं. सो थैंक यू सो मच फॉर योर टाइम. सो डॉक्टर प्रीति, आपके बारे में मैं कुछ जानना चाहूँगी कि आपने कैसे सोचा कि मैं डाइटिशियन बनना चाहती हूँ. पहले हम आपके बारे में कुछ जानना चाहते हैं.
Okay. So it is like now, so 18 years back, it is like a long time. So first I wanted to become a doctor only. So I chose this profession and then उसके बाद ही धीरे धीरे होता है ना, कई बार लाइंस कहीं भी ले जाती हैं आपको. Then I just joined Lady Win College in Delhi University and there I didn't know कि मुझे dietitian ही करना है. But उसके बाद धीरे धीरे you just get into it and you like to help people recovering their health problems. तो उसी तरफ जब गई तो फिर पहले मैंने internship भी करी and then I started with my own clinic. So up to like it is 17 years back that I've been started everything. So I've done my Ayurvedic nutrition also. So Ayurveda के हिसाब से हम कैसे spices and herbs अपनी diet में use कर सकते हैं for treating our things कि हम normally ठीक हो सके. Overall हमारी health improve हो सकती है. That's the thing.
Of course. And proper diet can, of course, lead us to happy and healthy life. That is so true. Or, of course, a lot of things are there and a lot of factors are there because आज के time में everybody wants to look good, everybody wants to be fit. So, खाना कितना important होता है, Dr. Preeti? Like, do you think like exercise is important or diet really matters a lot? So, please हमारे viewers को इसके बारे में बताइए because really they want to know so much about it and they really want to be fit.
Yes, surely. So what we say is generally diet is the best thing कि हमें 80% result जो है diet से ही मिल रहा है and then 20% is exercise. But we should do all these two things together to boost our metabolism also, for our overall health improvement also. जैसे अगर हम एक simple मैं बताती हूँ थायराइड के लिए अगर हम जनरली बात करते हैं तो हाइपोथायराइड में if you are exercising and you are not doing any diet then it will not work.
Oh.
You will have multiple problems. So again, exercise and diet both together with stress reduction and sleep. Everything is necessary for remaining healthy and curb your thyroid symptoms. क्योंकि थायराइड में बहुत सिम्टम्स ऐसे होते हैं जिसकी वजह से women को हेयर फॉल, स्किन इश्यूज, एक्ने, बहुत सारी प्रॉब्लम्स आती हैं. So that has to be curbed only by diet, exercise. मतलब सारा holistic approach we have to adopt. Then only it can be treated.
Yeah, recently I've been watching a lot of women having problem of thyroid. So what is the reason behind that? Like some of them are putting weight, some of them are losing weight on like I don't know what is the reason behind that. तो please इसके बारे में हमें बताइए.
So first, there are two types of thyroid when we talk about thyroid. So thyroid, it can be the hypothyroid in which you gain your weight also and multiple problems come. And one thyroid is hyperthyroid where weight loses constantly. So our metabolism increases like a speed rate होता है ना heart की बहुत तेज हो जाती है. तो ऐसे ही आपका metabolism बहुत स्पीड से हो जाता है. That also is harmful for our body. क्योंकि वो एकदम से आपको weak भी कर देगा and then organs भी weak हो जाते हैं. So both the thyroids are not at all good. And let us talk about the reasons. So reasons में सबसे पहला reason होता है stress. What I've seen is many years now during this COVID. So people are coming with the borderline thyroid. जिसमें कोई history भी नहीं थी, उनको heredity भी नहीं था, तब भी उनको borderline like it is TSH level is around 10. So 7 to 10 के बीच में जब आता है तो that is a borderline thyroid. So then they have got this thing. So because of the stress, their lifestyle eating habits are very crucial, important part. Then heredity is also an important part. कभी किसी के फादर या मदर को है तब भी थायराइड आ जाता है. बट जनरली अगर आप लाइफस्टाइल की बात करेंगे कि बिल्कुल हम एक्सरसाइज नहीं करते, सेडेंटरी लाइफस्टाइल है, वी आर ईटिंग जंक आल्सो, फ्राइड आल्सो, सो दिस आल्सो कंट्रीब्यूट इन थायराइड डेवलपमेंट. या फिर किसी को हार्मोनल इश्यूज है, सपोज किसी को पीसीओडी है या कोई और अदर हार्मोनल इशू है, एस्ट्रोजन का डिफरेंस है या कुछ भी, तो दैट आल्सो लीड्स टू दिस थायराइड हार्मोन disturbance. So it's सब कुछ interlinked. So that is why we can say कि we should work on all these things in this pandemic time.
एब्सोल्युटली। जैसे कि आप मुझे बता रहे हैं कि प्रॉपर डाइट हो एंड थिंग्स लाइक खाने को हम तरीके से खाएं, तरीके से सोएं, तो ये प्रॉब्लम्स नहीं आती है और आप एक हेल्दी लाइफ लीड कर सकते हो। लेकिन आज का जो दौर है इट्स वेरी स्ट्रेसफुल, और स्ट्रेस में लोगों को मैंने देखा है, वो कुछ लोग तो बहुत ज़्यादा खाना खाना शुरू कर देते हैं, एंड सम पीपल दे डोंट नो कि उन्हें जानकारी नहीं इसके बारे में कि कब खाना चाहिए, कब नहीं खाना चाहिए। एक सिंपल सा लॉजिक है जो सबने सुना है कि ब्रेकफास्ट शुड बी हैवी, देन लंच शुड बी लाइक ओके, एंड देन आप डिनर में तो बिल्कुल ना के बराबर ही खाएं। तो हाउ यू प्लान द डाइट, आप क्या देखते हैं, एंड हाउ यू सजेस्ट समवन लाइक व्हाट इज द प्रॉपर डाइट फॉर दैट पर्सन?
I'll just tell you about this, Rashmi. So this is like diet is always individualized. क्योंकि कई बार क्या होता है, I treat my clients जो कि बिल्कुल कुछ नहीं खाते पूरे दिन, they are just eating small meals, और वो भी बहुत ही कम, quantity proportion control is zero. So उससे भी metabolism slow हो जाता है. So there should be a proper amount of food that you should eat. लाइक अगर आपको ब्रेकफास्ट करना है तो जरूरी नहीं है कि ब्रेकफास्ट में आपको किंग साइज ही खाना है. इट इज डिपेंडिंग ऑन योर स्टमक हंगर. तो अगर आपको लगता है कि सुबह आपको भूख लगती है, देन यू शुड ईट प्रॉपरली, लाइक वन रोटी स्टफ करके भी आप ले सकते हो. दैट इज अ इजी थिंग, जो कि क्योंकि आई एम जस्ट टेलिंग यू दोज options which are easy to make,
Yeah.
like oat chia you can take. So those options, अगर कोई non veg है तो egg is a good breakfast, so that they can take. So these type of things you can easily include in breakfast. But अगर कोई होता है कि जिसको भूख ही नहीं लगती morning में, they feel कि they don't want to eat, so they can have fruits also. So there is no specific rule कि हमें सुबह बहुत अच्छे से खाना है या नहीं खाना. So it is depending on individual to individual. If individual is feeling hungry at that time, they should eat. And if the person is feeling ki I'm okay and I'm full at this time also, then they should have the fruits. But something should be taken. It should not be ki aap kuch bhi nahi le rahe. And one more thing, intermittent fasting also is a good way of losing weight also and staying disciplined when we talk about it. So you can choose just 8 hours window, and then you can try that. But we should not do that four hours window, because that will again slow down our metabolism. 8 hours में क्या होता है? Like simple example I'll give you. 11 to 7, if you just opt for it. 11 in the morning you take your breakfast, then 2 o'clock is the lunch, then 5 o'clock your tea or fruits, and then 7 o'clock you just finish your dinner. So that also is very helpful with losing weight also and for increasing metabolism. And thyroid and diabetes, I've seen so many things which are curing after this intermittent fasting. But it should be 8 hours at least.
बिकॉज डाइट के बारे में लोग ऐसे सोचते हैं, इफ दे वांट टू लूज वेट सो सिंपली दे विल कम ईदर ऑन सैलड्स or they'll start. I've recently heard one of my friends, like her son was doing keto and he fainted. So what do you suggest कि ये सब करना चाहिए या नहीं करना चाहिए, और कैसे जाना जाए कि शरीर को प्रॉपर मात्रा में कितना खाना चाहिए?
दैट्स ट्रू. क्योंकि कीटो है या जो भी बिल्कुल ही स्ट्रिक्ट डाइट्स पे चले जाते हैं ना, सैलेड्स ही ले रहे हैं या कीटो चले जाते हैं या ऑफ ग्लूटेन भी चले जाते हैं. मैंने काफियों को देखा है ग्लूटेन फ्री भी करते हैं. तो दैट इज, अगर आपको कोई प्रॉब्लम है एलर्जिक टू ग्लूटेन हो, देन यू कैन डू इट. या फिर अगर कीटो भी आपको प्रॉपर तरीके से बिल्कुल नहीं करना चाहिए, बिकॉज द थिंग इज इट इज इफेक्टिंग यू इन द लॉन्ग रन फॉर द लिवर ऑल्सो, फॉर द किडनी ऑल्सो. यू मस्ट बी, अभी तो आपने अपने फ्रेंड के बेटे का बताया, ऐसे ही आई हैव सीन इन बॉलीवुड इंडस्ट्री ऑल्सो so many people who were following and किसी को कोई ना कोई problems आई. So we should not go for these fat diets. एक healthy balanced diet is very important. And उसमें आपका carbs भी होना चाहिए, protein भी होना चाहिए, fiber, fruits, vegetables, everything should be included in the diet. And fat को भी भूलना नहीं चाहिए. कई लोग कहते हैं कि ना सिर्फ salads ही लेते हैं. That is also again not good for the body. Because again it will dry your body. So fat is again very necessary because it has vitamin E, essential fatty acids, which are necessary for our skin, for our health of every organ. So we should take everything in equal amount. तो नहीं कह सकते, but हाँ, fiber should be more when we talk about it. Carbs should be your 30%, then 30% your protein, and mainly आपका जो fat है वो 5 to 10% should be there in the diet.
ओके.
And fiber should
एंड बहुत से व्यूअर्स का ये भी क्वेश्चन था जब उन्हें पता लगा कि आप शो पे आ रही हैं कि अबाउट रोटी एंड राइस, लाइक उन्होंने बिल्कुल छोड़ दिया है. सो व्हाट इज योर कॉल ऑन दैट, व्हाट डू यू सजेस्ट?
That's what I'm saying ना, हाँ, carbs are also necessary. It should be 30% of our diet. तो हमें कभी भी छोड़ना नहीं चाहिए. हाँ, one meal में if you don't want to have roti या rice, you can opt for other things also. like mungal chila, you can have besan chila, you can have dokla also if they can make it at home, sprouts le sakte hain, but one meal mein at least one or two roti should be taken. The lunch time पे you take your roti or rice, but you should not combine the two things together. What I've seen ना कि people who are doing it, they say कि हमने just एक चम्मच ही चावल लिया था, so that will not help. If you're taking roti, take two rotis. If you're taking rice, take one katori of rice, because that is necessary for your overall development also. क्योंकि carbohydrates are necessary for our growth of the body. Energy के लिए सबसे ज़्यादा जरूरी है. So कई बार लोग faint हो जाते हैं, that is the reason they are not taking at all. The carbohydrate is missing in their diet, so it should not be.
So tell me one thing, like if any patient comes to you, patient in a way like if someone is feeling कि नहीं मुझे weight lose करना है and I, तो आप किस तरह से उसे like follow up करते हैं या किस तरह से उन्हें बताते हैं क्या करते हैं, what is the procedure, like if there's someone connects with you and they want to lose maybe 10 pounds, so how it works?
So it works like, first we'll ask them that what is the problem, how have they gained weight, because we need to take their history.
Okay.
Previous history is very important while we start the diet. So then I'll send the form so that they can fill it up, and then we'll fix the video call. So after video call, I'll just understand their body type. कि Ayurveda के हिसाब से what is prevalent in them. Suppose they have the pitta dosh, pitta of the heat. That body is having more of heat or more of bath. Bath is आपका air होता है.
Yeah.
What is the component which is more in their body? According to that also, and what their eating habits were. And होता है ना कि उनके dislikes and likes have to be seen. Some people just have to see कि some people can't even just leave one roti also. They want every meal कि वो रोटी तो खाएंगे ही खाएंगे. Carbs should be there. Then also the diet is made. And some people say कि we don't want any carbs at all. But then also we give different type of things. Like अगर रोटी नहीं अच्छी लगती, suppose in US also or in London, I have seen my clients, they don't want to make roti because roti making they feel it's a task for them.
Yeah.
So what we do is we give them chila.
Okay.
Chila they can make. Like oat chila hai, besan chila hai, mungal chila hai. These can be easily made because just a batter they have to mix it and they have to make on the non-stick pan. So they can do like that also. They can have salads. Like one meal salads is okay, that's not a problem. But one meal should be proper. Like your lunch meal should be your rice. And rice is also not at all so much calories that we are assuming कि rice खाएंगे तो पता नहीं कितना weight put on हो जाएगा. It doesn't matter because you have to take in portion control. So one katori rice you are taking and like in once like 3 times a week. So then it is not harming at all. So you can take that time also. So what we'll approach is, so first we'll take the video call, the history and everything, understanding the needs also of the client, what things they want, and then we prepare the diet accordingly. So that's according to them. So it's not, way I'm saying it is not same for every individual. It's different for everyone.
So do you make a special packages like कि आप कुछ time limit बताते हैं कि इतने time में आप करेंगे तो इस तरह से आप में change होगा या this you can control your weight, how it works? क्या उनका 3 महीने का या 6 महीने का कुछ ऐसा होता है, किस तरह से होता है आप आपसे जब वो connect होते हैं?
So again, it depends on the individual to individual. I have the girls who just want to lose 3 kgs. So I'll just give them 1 month. So 1 month may, if they have followed it properly, they can easily lose 2 to 3 kgs, whichever their requirement is, because those are 54, 55 weight. So they want to just have 52. So there's no way that we have to do it for 3 months. So just 1 month we have to do for weight loss and 1 month for maintenance. But those who want to do for 10 kgs, like 10 kilo of weight they want to lose. So then I suggest that at least go for 3 months of package, because then only you will be able to reduce that, and then we have to continue for 1 more month for the maintenance, because maintenance is very much necessary. Otherwise they start putting on it what they have lost.
Yeah, Dr. Preeti, like you're saying कि आप जैसे बना के देते हो कि इतना इतना portion होना चाहिए खाने का, but if someone is not able to control, फिर वो क्या करें उस time?
Then we have to ask them na, ki what are the cravings that they are getting.
Okay.
So we have to solve it. That's why we have to video call them, then we have to counsel them that this should be taken. Otherwise, all other things then we have to restrict. Suppose he is not able to cut the rotis. They are taking 2 to 3 rotis. Then it's okay. Then we'll cut on all other things like protein. Then we'll cut. We'll say one day you don't take roti. Take your proteins more. then your routine. So we have to just counsel the patients according to their time. And sometimes they lose also weight. That's not a problem. The timing matters. So when they eat it, their dinner like before 7, then also they easily lose weight. So that is again, timing also is very important when we are doing the diet.
एब्सोल्युटली बिल्कुल आप ठीक कह रहे हैं डॉक्टर प्रीति एंड ऑफ कोर्स बहुत ही आपका मुझे कहना चाहिए कि यू आर प्लेइंग वेरी वेरी इंपॉर्टेंट रोल इन द कम्युनिटी एंड एवरीबडी इज लुकिंग फॉरवर्ड टू कनेक्ट विथ यू एक्चुअली सो आपसे कनेक्ट होने के लिए क्या तरीका है लाइक आपसे जुड़ना चाहें कोई आपसे बात करना चाहें दे वांट टू टेक अ प्रॉपर डाइट प्लान सो हाउ टू कनेक्ट विथ यू
So they can, I have a WhatsApp, the same number is there on WhatsApp and my normal call. So it is like 9871290027. So they can call me at that number or just send me a message on WhatsApp, or they can just message me on Instagram because I'm there on Instagram also. So dietitian_Preeti is my Insta ID. So they can go and just message me there also. So then I'll give them a call or something like that and then we'll connect. That's not a problem, because I'm taking the clients from abroad, so they are able to connect with the WhatsApp call also. There are now so many things like we are doing Skype also. So everything, there's a option that we can easily connect on Zoom also. So these are the some platforms that we can get them counsel and start their diet.
Absolutely. And Dr. Preeti, one more thing. Is it guaranteed they will lose weight or if some people want to put on weight also? So it works, right?
Yeah. I've just treated so many patients, so many clients with the loss of weight that they were losing weight and they wanted to gain weight.
Okay.
But then again, they have to follow a proper discipline, because sometimes now they just leave it in between. They get fed up of eating. They get fed up of exercising. So all the things have to be, parameters have to be met. Then only they will gain weight. But losing weight, yes, I have seen that like 90 to 95% of my clients lose weight very easily. That's not a problem. But some of them are rigid also, because their body have been at stagnant weight from very past long, or they have so many problems or issues in the body. So then also they'll be getting tackled, and sometimes what happens, if they're not losing weight, they are losing in inches. So that is the best thing, that they are losing fat from the body. So at least they should be happy that they are looking slimmer and they are not losing, then they are not gaining also weight. Because I've seen those one or two of my clients, they are not losing weight, but they are losing in inches. Their clothes are fitting better. Their bloating is reduced. So this is like this type of improvement they get. Their medicines have reduced. Some painkillers they have reduced, or hypertension ki medicine, BP medicine they have just dropped because of the diet. So these are also positive signs that they get after doing the proper healthy balanced diet.
बहुत अच्छा लगा डॉक्टर प्रीति आपसे आज बात करके इट वाज रियली नाइस वेरी इंफॉर्मेटिव सेशन और व्यूअर्स एनी क्वेश्चन यू हैव डॉक्टर प्रीति हैव ऑलरेडी शेयर्ड हर नंबर और डॉक्टर प्रीति आपकी वेबसाइट भी है
Yes, I have a website also. तो वेबसाइट का लिंक है www.perfecthealthbypreeti.com.
थैंक यू सो मच डॉक्टर प्रीति इट वाज रियली नाइस टॉकिंग टू यू और जल्दी आपसे फिर मुलाकात होगी हमारे हेल्थ टॉक शो में और बिफोर वी एंड द शो मैं चाहूंगी आप कुछ मैसेज देना चाहेंगे हमारे व्यूअर्स को
Yes. So thank you, Rashmi, for this opportunity. And I want that viewers should maintain their health. So it is not important कि आप slim रहो या मोटे रहो, but you should be healthy enough. So healthy के लिए you should take a proper diet. मतलब diet in the sense you should eat, because I have seen so many girls that they are starving themselves. They think कि हम नहीं खाएंगे तो हम पतले हो जाएंगे. So this should not be the reason. We should eat it properly. We should exercise it, and every parameter should be taken care, because health is wealth. आप health का ध्यान रख रहे हो तो everything is else controlled.
Thank you so much, Dr. Preeti. It was nice talking to you. Thanks a ton. Thank you.
Thank you, Rashmi. Thanks a lot. Thank you.